Hi, my name is Russ Knopp, and I'm the owner of Comfort Keepers and a proud supporter of the Hot Topics series. For the last 15 years, we have been keeping seniors safe and happy in their homes. I'd like to give a shout out right now to all the Comfort Keepers who are working around the clock to keep our clients safe and happy during this pandemic. We are proud to support the Hot Topics series in partnership with the Petoskey Chamber of Commerce. The Chamber has always been an awesome resource for us business owners. And during this pandemic, they've just stepped up their game even farther. Thank you, Petoskey Chamber of Commerce. We have Comfort Keepers. Hope you find today's presentation useful. As always, if you're in further need of assistance, please contact the Chamber. Thank you and enjoy the presentation.
Hi, and welcome to another Hot Topics focus on health with the Petoskey Chamber. I am Nikki Devitt, president of the Petoskey Regional Chamber of Commerce. And joining me today in this Petoskey Strong interview is Dr. Josh Meyerson, the medical director of the health department of Northwest Michigan. Thank you for joining us, Dr. Meyerson.
Thank you for having me today, Nikki.
We appreciate it. We wanted to take an opportunity to help our community and our businesses understand the importance of not only wearing a mask, but the importance of your local health department and what you do in every day since the last 8 months has been absolutely incredible. So first and foremost, kudos to you and your staff for your absolute and total dedication to our community and keeping us informed. And I think probably one thing that we have talked about, you and I, is that we hear so much about COVID and testing and tracing and everything. We hear it from Dr. Fauci, we hear it from our state, we hear it from our governor, but I think it really helps to kind of get a local perspective too. And so, I spoke with Dr. Dan Beston earlier and was told that the respiratory unit, here we are, the end of October, is full again. Tell us about what that second wave means and what it is and where are we now as a community?
Sure. Well, thank you. And our staff have been working tirelessly and 7 days a week, every day, long days, since this started back beginning of March. And communicable disease investigation and reporting is one of the essential services of the local health departments. It's done at the local level. And so it's something we've always done, but obviously things have ramped up to levels far beyond really what anyone would have imagined a year ago. So, with the early surge that happened across the country in the spring and into the summer, I think Northern Michigan was a bit spared. And I think we did a great job up here. The people did a great job. And we really, we had some initial cases early on, and that the curve was flattened, or as Dr. Den Beston said, it was crushed. And that really is kudos to everyone in the community and a lot of hard work by everybody and dedication. And then summer came, and our seasonal guests came, and our seasonal residents came, and our population surged. And we had increases in cases in July and the summer. But I think, for a lot of different reasons, that was much more manageable than it is now. The weather was nicer, people were outdoors. I think people were also a lot more cognizant of it. They were still kind of keeping their guard up, watching their social gatherings. They were able to do things outdoors that helps quite well to reduce disease transmission. So now here we are, and we saw an increase in cases even starting back in August and September. But now, just to give people an idea, I've been sharing this data in our 4-county district. If you look 3 weeks ago, I went back 3 weeks, 21 days from yesterday. And in a 7-day period, we were averaging just 3 weeks ago, 4 cases a day, 4.3. And that was still kept us pretty busy. Each case takes a while to contact and figure out all their number of contacts they have, and then notify those people and get them quarantined and all of that. And we were noticing even back then that the number of contacts that everybody had was starting to creep up as people we all kind of let our guard down a little bit. And then 2 weeks ago, our rates doubled, and we were getting 8.5 cases a day. And then in the last week, they quadrupled from that to over 26 a day. So we've had a 6-fold increase in 3 weeks. Yesterday, we had 51 cases reported to our health department. That is a tremendous surge. Those number of cases are far beyond our capacity to fully and rapidly investigate. We have ramped up staffing, our nurses and our case investigators. We have pulled in staff from all parts of the health department. We've cut back on services that we're doing in other areas of the health department. And doing our best, we are prioritizing the cases that need to be investigated based on if they're involving schools or other centers where there might be a lot of people impacted. But there are delays now occurring because of the number of cases. So, there have been outbreaks. Some of those outbreaks are in workplaces. Some of those outbreaks are from large gatherings, people who may have traveled or gone to weddings. And some of the outbreaks are associated with small gatherings. It's across all age groups, and it's in all of our counties. So, sometimes people want to blame it. Whose fault is it? Why is this? Someone must be doing something wrong. And I think my answer really is that it's all of us. It's a contagious respiratory virus. It is very easy to spread, and it's hard to control. And it takes all of us to do what we can collectively to reduce that disease transmission. And Nick, you did a great job of highlighting those just earlier in our discussion that, people need to wear a mask. It's always better to have a mask on than a mask off, but to keep your distance, really to think about those gatherings. I mean, wearing a mask, but being in a group with a large number of people indoors is still not a safe activity, especially if people are getting together and sharing a meal, they're eating, they're drinking. You can't do that with a mask on, and that's going to increase your risk. The longer you're with people, that increases your risk, and not being able to maintain that 6-foot distance for the main part of the time that you're together. So all of those things are important. The other thing is if people are sick, they really need to stay home. They shouldn't be going to work. They shouldn't be going to that dinner party or to that football game. They should be staying home if they're not feeling well. And if you are getting tested because you're not feeling well or you're exposed, certainly if you're, and that's great that you're going to get tested and find out, please stay home while you're waiting for the results. Because remember, when you're positive with COVID, whether you're sick or your test is positive, we're going to go back 2 days before your symptoms started. So we all have that responsibility to think when we're doing something, where have I been the last 2 days? If I start getting a fever or a cough today, I have to start thinking, who have I exposed in the 2 days prior? And we're trying to keep that number as low as possible.
And I think that's a great point too, that, we can absolutely engage our economy and keep our businesses open and go about a portion of our daily lives as we have for the last 8 months in different varying, ways as we've been given more and more leeway here and there. And we managed, as you pointed out, so well in the summer months with an even larger increased population to keep our numbers, although they were fluctuating, they weren't to the point where we're seeing that second surge and know that we're in for the roller coaster ride, as Dr. Fauci calls it. So, but what we were doing then too, is I think we were more cognizant. We were thinking, always ask yourself, if I get the call from the health department that my test is positive, or I find out that I've been exposed by someone else in a close contact form, am I going to feel comfortable answering where I've been? Am I going to feel good about myself, knowing my behaviors didn't put someone else at risk? And, how important that is to just wear that mask and keep the distance when you can. And if you're doing gatherings, that social circle, and the reason they've always kept that number as a 10 indoors and, for those interior home groups is that there's a reason for it. You need to be able to account for your whereabouts, account for your activities, and make sure that you're really, truly keeping in mind at all times that you have to be safe. This is how we go through this. This is not a sprint, as Dr. Denboston called it. It's a marathon. This is a long term.
Right.
This is not, we get COVID fatigue. We all have it. Everyone is exhausted of COVID and everything that it causes us to do and what it's done to our lives. But regardless, it's not going to go away just because we're tired of it. And I think that
Right.
what the health department does, as far as when you're talking about a six-fold increase in cases and what that means, we can hear from somebody downstate that's getting 300 or 400 cases in a county in a day, and we get 55 in our region, and we're like, that's for our capacities, that's huge. That's a lot for our population.
Right. And
that's
in your area, we only have one hospital.
Right.
And our cases have gone up. I've had people say, well, we're testing more. And we still don't have the full access to testing that I'd like, but our percent positivity is going up. And as you've reported from the hospital, our hospitalized cases have gone up to the highest census they've had during this entire pandemic. So that tells you right there, that's very clear that the impact is very real. And we are in the midst of a surge. It is affecting people. The hospital is now having to open up additional units, and their capacity is they only have so many beds. We only have the one hospital. So those are things for everyone to remember as we try to keep our community functioning and open. We have a responsibility to do that safely.
Yes, it's absolutely, we say it so often here at the Chamber, stay safe to stay open. And that's what it is. It's staying safe to stay open and doing the best we can to make sure that the entire community is taken care of. And it's not just, you mentioned it yourself, we have to start making accommodations. Our healthcare system will make accommodations to treat what it needs to with COVID, and cutting back and moving staff and saying, okay, we've got to, limit this right now. That everybody remembers way back when in March, when there was no elective surgeries, when there was no, certain procedures in place. And we don't want to get back to that kind of lockdown state. And to do that, as simple as just being smart and safe can get us moving forward. I want to highlight
that's our goal here. We need to keep our healthcare system functioning for everyone, and to prevent them from being overwhelmed. We all need to work at this together, and
yes.
None of us want to go back to a lockdown. It doesn't help. There's all sorts of reasons why no one wants to go there. We don't want to shutter our town up. So the only way we can be open is in ways that really help mitigate the impact of that interaction.
Absolutely. We talk at the Chamber, we've said several times too, that it's a three-prong that we face here. It is a public health crisis, it is an economic crisis, and it's a mental health crisis, as the stress that it takes as individuals and community members to live in this new way. And so, to help sustain all three of those things, the common sense practices are what should be put in place by everyone at this time, regardless of what you feel. It's what is the right thing to do. And people are constantly looking for information and updates. I think us as a community have been fantastic. I will say that, surge or not, and slip in a little bit of COVID fatigue or not, we really have been a stellar community. There's a reason our region got open earlier than anyone else. It's because we showed that we were responsible, and I think we can definitely continue that. Information is something everybody is wanting when it comes to this, and your website, nwhealth.org, has been incredible. Your Facebook and social, what you do to inform the community, I have to give you huge props for that. It's, I know people that, wait every day to go, okay, where are we at today? Are we doing better? Hey, get a pat on the back, or shame on us.
Well, I'll pass that along because I have nothing to do with social media. So
Tell them they're doing a very good job. But your website has a huge amount of resources. We redirect from our Petoskey Strong website. We redirect all our businesses to yours because you're going to have the latest resources as we do for, what are the safety requirements from the Michigan Department of Health and Human Services? What is best practices? What works best for your business? And really reminding yourself of those resources is a good thing too. And I know you are busy, so I'm not going to keep you long. Is there anything that, critical information that helps people? I think some of the numbers that you just gave us and some of the statistics as to where we were 21 days ago, this is going to be a long ride, isn't it? We got to prepare for that.
It is. And it is a marathon, and we're right now in the midst of a surge, and we want to see that wave crest and start to flatten out and hopefully turn downward. It's not going to necessarily happen by itself. It's going to take all of us working together to get there. One other thing people do, some people get very concerned. They want to know where COVID is. They're looking at exposure sites and things. And I think that the important message is that really everyone, when you leave your house, when you're out in public, whether you're at your neighbor's house, your friend's place, a restaurant, a bar, a retail establishment, you should assume that the virus is there, that you could be exposed or you could be exposing someone else when you go out. And you need to make that assumption wherever you go. We have community-based transmission. In the last 2 weeks, for instance, looking across a region in the data that we have from our case investigations, that's in the northern Michigan region, about a third of the cases don't know where they got sick, where they got the virus. Certainly, in the other 2/3, it was their household members or their friend that they were with was sick, or they were one of their coworkers was sick, and they know where they got it. But a third of the time they don't. It was just going about their daily life, and they were exposed and infected and got sick. So I think people need to just make that assumption wherever they go and not worry so much about where it was reported last week, because that won't really tell you where it is today.
I could not agree more, and thank you for making that point, because it does no good to know that. I mean, it does you good, but in the same token, as you said, it's everywhere now because
it brings out awareness, and I think at this point, I want everyone to be aware that it is out there, and it's not any one store or any one town. There's nowhere to avoid it other than staying at home and keeping your circle as small as possible.
Right. And it's not,
of course, wearing your mask, washing your hands.
Yeah. And when you go out, and there are ways to support local businesses and do that safely. In so many ways. And our local businesses are working so hard to keep their doors open and keep their employees safe and keep their community safe. And, that needs to be lauded as well. And we appreciate all that they're doing to try to make sure that this time next year, we're all here still and we're all moving forward in another direction. So.
Yeah. And the people you gave us, I always think about how hard our workers and the people that are, out there in the public, serving the public, whether it's in a food service establishment or a retail establishment or at the grocery store, they're out there literally putting their lives on the line so that we can get the things that we want or need. And I think it's really important that people realize that and have gratitude for that, and to treat them with the utmost respect and respect the need to keep them safe. And in that, regardless of whatever state laws, orders, directives come down, our recommendations don't change. I think, in this region, regardless of what is, quote, required or legal, that doesn't change our recommendations for staying safe to stay open.
Absolutely. And I appreciate you bringing that up. And the recommendations are for your benefit and the rest of your community too. And that's something that needs to be, that we need to take that social responsibility for. And another thank you for pointing out our frontline workers. They are and have been the lifeblood of what has allowed us to even be here. They're functioning on, as you said, you are, and I know we are here too, that 7 days a week lifestyle. That's what they're doing too, just so that you can have the wants and needs that you have. And if it was not for them and they're taking the brunt of the angst and the argument and the I hate a mask or, you know, whatever that negativity is, they take
they don't deserve that.
and they
deserve
do
the
not.
respect.
And they didn't make the rules. And they didn't,
Right.
you know, they're not responsible for COVID. So show them a little respect and love.
Right.
So fantastic. Anything else you want to add?
I don't think so. I think we've covered, we've hit all the highlights.
We hit all the highlights, but we can always check in again in a couple weeks too and see how things are going. And I appreciate that you point out too that, you know, it doesn't matter what it is or who it's from that says wear a mask and spread out and be kind and all those good things. It's just the right thing to do. And we in our region are definitely a strong enough community that we can do that without a doubt. We don't need guidance to do that.
Yep.
Yeah, we are very. nwhealth.org. And then of course, they have a great social media website as well. Definitely, if you have questions, you will find your answers on our local health department's website, and we'll do another check-in soon. Thank you so much, Dr. Meisen. I appreciate it.
All right. Thank you very much.